I'm Dr. Craig Brown, and I want to talk to you about expansive medicine here at the Holistic Health Social Network. I want you to picture mainstream medicine is in the middle of an unstretched. It's the unstretched rubber band. It's going to be in the middle. Once we stretch it, on either side, you have more rubber band. To the left, we're going to have preventive medicine. To the right, we're going to have an approaching to a cure. In the middle, we're going to have mainstream medicine, which consists of diagnosis, testing and diagnosis. It consists of prescription drug treatment, and it consists of surgical treatment. What I'd like to do is try to show you how to make yourself so healthy to avoid the middle of that rubber band. There are places where that middle of that rubber band, mainstream medicine, is very necessary. And the work and the discoveries that we've had in mainstream medicine have been marvelous. Did you know that the United States is ranked number 13 in the world in healthcare? We are the biggest superpower in the world, but we're rated number 13. And I think we can do better. And here's how. As I said, when we expand medicine to the parameters where it's supposed to be, what you're going to be doing is we're going to work with preventive medicine. We're going to try to find out why and what happens prior to that first visit to the doctor. When you go to your doctor or your cardiologist, I have chest pain, or I have this rash, or I have this mark on my skin, or I have swollen ankles, or I'm having problems breathing, or I have bad allergies to this, that, or the other thing, or I get flus and pneumonia or bronchitis every winter. We want to address that. We want to see if we can avoid that. And what's causing all that? In my opinion, we are in a battle, and we're basically in a battle for our lives. And our battle for our lives is against microorganisms. In school, we learn all the different types of microorganisms. I'm sharing with you today. We learn about viruses. We learn about yeast. We learn about parasites. We learn about the bad bacteria. These are all competing in our body for our nutrients, for our oxygen, for our minerals. And in many cases, they win the battle. What we want to do is we want to decrease the population. We want to decrease the parasites and the viruses, the yeasts, and bad bacteria. We want to decrease the population. In my opinion, we will see healthier people. We will see less terminal diseases. We will see a longer lifespan. We'll see more quality of life. We'll see anti-aging, which we all talk about. We'll see rejuvenation. And there's a lot of physiological reasons why. And a lot of things that I'll be discussing with you will help us understand how we can actually stay younger, even become younger. As crazy as that sounds, I've seen it. I've worked with it. I've done it with myself and family. I've done it with patients. It's out there. It's out there. What it takes is compliance, and it takes discipline, and it today is start at the very beginning. The very beginning is where I think there is a disconnect in medicine. There's a disconnect in medicine between the dental physician or the oral physician and the physician. And we're not seeing a connection. The oral cavity is an amazing place for early diagnosis. For example, and this has been out there for about 15, 20 years, there is a connection between periodontal disease, oral pathology, and cardiovascular disease, heart problems. This is not something that the medical profession is not aware of. Last time I looked, there was over 300 articles, research articles done in the States about the connection between heart disease and oral pathology. Is there a connection between viruses and the flu, or weakening of the immune system? Is there a connection between some of the microorganisms in the oral cavity and systemically? It makes sense that it would be. In our mouths, we have certain types of microorganisms that we do not want there. And we really, I don't see dental medicine or the systemic medicine attacking the problem on any realistic level. Nothing that's really worked to where we want it to work. And I'm going to be talking about what I think works. We have actinomycosis in the mouth. This is on the root. We have bacteria, we have yeast, we have candidiasis. We've all heard of thrush, which people get on the tongue. It's candida on the tongue. There's systemic candida. I'm seeing more and more people complaining about systemic candida than I have in years over the last 5. And in my opinion, it's coming from the oral cavity. It's one of the entrance points. We have a number of entrance points in our body. We have the skin that we either lose or have things come into our body through. We have the eyes, we have the nose, we have the ears, and the oral cavity. We have the mouth. So we have lactobacillus, which is a bacteria. We have Streptococcus mutans, which is a strep in the oral cavity, and probably a plethora of many more microorganisms, which we attack by brushing and flossing, by tongue brushing and tongue scraping, and occasionally, if you go to your doctor, by oral and localizing antibiotics. It's not doing the job. Whatever population count we're lowering in the mouth with those tools is not anywhere coming close to getting us on a better track for healthcare or saving our lives. So we have to attack it a different way. And we have to attack it not only orally, but we have to attack it systemically. Because it's not going to be impossible, but some are going to get through. So that's going to be my focus over the next number of lectures. We're going to be talking about how to stop these microorganisms, these yeast, parasites, bacteria, the viruses, from competing with the vital nutrients and vitamins and protein and carbohydrates that we need. How to make them less comfortable in our environment. We are their host, and we don't want to be a very fun host for them. We want to get rid of them. So I'm going to show you how to lower the population, if not nullify it completely. And in my opinion, we'll be expanding medicine basically to avoid, as much as we possibly can, the middle part that exists today. It's not going to happen every single time, but we're sure going to make it more difficult to sit in that middle range. This is the only way I can see at this point in medical research that we can find a way to prevent, which I consider prevention, just the definition of prevention, is the cure. If you don't get the disease, and you would have, in my opinion, you cured it, in essence. You cured the problem. And we can talk about curing the problem instead of curing the disease. And the problem is how we're supplying our food, how we're taking care of our bodies, and what we're eating, what we're drinking, what we're being sold. And I think we're being sold a little bit.